Hello, my name is Dr. Razmik Krumyan, and I'm the medical director here at Buena Vista Hospice Care. We are a full-service hospice agency. We have most of our care takes place at the patient's home, wherever the home may be. Some patients are in their private homes, others can be in assisted living facilities or nursing homes. So a patient qualifies for hospice care when there is the understanding that more than likely this patient has a life expectancy of 6 months or less, and that is determined by the patient's personal physician, or as well in collaboration with the patient and the family members to make that determination. Oftentimes a patient may make the decision to no longer seek aggressive care, may make the decision that they would like to stay home as long as possible to be comfortable. Oftentimes a lot of our patients have been in and out of the hospital settings, and frankly they've had it with hospitals, and the last thing they want to do is go back to the hospital. By electing hospice care and by making the decision to be at home, essentially they're able to fulfill their wishes at the end of life to no longer go back to the hospital. And this way we're able to provide comfort and take care of any medical needs that may arise in the comfort of the patient's home. So the goal of hospice care is to provide comfort to the patient towards the end of their life. It is not meant to be curative. For instance, it is not meant to pursue every disease process. There's a cliche adage that hospice is meant to bring life to your days and not days to your life. Some of the misconceptions that patients will have is that, in a patient who's on hospice care will be neglected, their medical needs will not be met. It's actually the exact opposite. If a patient has a bladder infection, by all means we can address that. If a patient has a bronchitis or upper respiratory infection, a skin infection, by all means those will be addressed and will not be neglected. However, if a patient has for instance, cancer, we're not going to be giving that patient chemotherapy anymore, because it doesn't really add to the patient's comfort and just prolongs sometimes discomfort. Patients will say, or families will say, I wish we knew about you guys 5 months ago or 3 months ago. We get that a lot. And the reason for that is when you elect to have the hospice benefit, you get a group of nurses who will come and visit you at home as frequently as needed. And so when there's a medical condition that if a patient's decompensating, then those issues are tackled before it becomes a big problem. In a way, it becomes preventative care, which is kind of a weird concept towards the end of life. But essentially, that's what you're doing: is you're taking care of situations before they become worse. The nurses are always in touch with a physician. You'll gain things and not lose, because you can continue to have your own private physician, but on top of that, now you have this group of hospice doctors trying to provide you with care. You can get house calls, where if you're debilitated and it's tough for you to leave the house and you don't want to leave the house, how nice is it for a physician to come to you? Bottom line, you get more attention, more nursing care, more social care, more physicians looking after you at the comfort of your own home.